When one is considering a shoulder replacement surgery and wondering what are the indications, why might I need a shoulder replacement surgery? Realize again, there's two types of replacements. There's an anatomic shoulder replacement, and typically when you have an anatomic shoulder replacement, that is 100% because you have arthritis. There's varying degrees of arthritis, but the reason one has an anatomic shoulder replacement is due to glenohumeral or shoulder arthritis. The reverse total shoulder has many different indications. So you can need a reverse total shoulder because you have a really bad rotator cuff. That actually was why the reverse was developed, for people who had a rotator cuff tear that was so bad it couldn't be fixed. So the reverse will help people with bad rotator cuffs, but it also helps people with bad arthritis. Some people have really severe arthritis that has worn through the socket bone, and the reverse allows us to deal with really complex bone deformity much better than the anatomic. If you break your shoulder and have a really bad fracture, the reverse is a much better option than an anatomic total shoulder. So many people have a reverse arthroplasty because they had a bad shoulder break that wasn't fixable. So those are really the main reasons that you might need a reverse total shoulder or an anatomic total shoulder.